and thank you. I'm delighted to be here today to address the House on what was an important issue, I think, when the invitation went out, and has become decidedly more so now, obviously, since the arrival of this new variant. So I very much welcome the opportunity to update the House on the epidemiological situation and on the national response to what's going on. The current level of COVID-19, as colleagues will be aware, is having a profoundly negative effect on public health, as well as placing an enormous burden on all aspects of our health service. The number of confirmed cases of COVID-19 in hospital, including an ICU, is still very high, and more generally, the overall level of infection continues to have a disproportionate and very disruptive impact across the system. We're seeing case numbers now previously seen only in January of this year. We know, of course, that the situation here in Ireland is not unique. We know that countries right across Europe are seeing a surge of cases, and we've heard from the WHO's recent warning that Europe is once again at the epicentre of this pandemic. Many EU countries are introducing new coronavirus restrictions. This includes reintroducing measures that we have retained, such as masks, COVID certs, while others are having to go further, including, for example, the lockdown reimposed in Austria and partial lockdown in the Netherlands. The situation across the EU, as we all know, remains fluid and it remains uncertain. As we've seen throughout the course of the pandemic, COVID-19 continues to adapt and to create very significant challenges, and of course the pandemic is not over yet. And that most recent challenge, of course, is the new variant, Omicron, or B11529 as it was. I'd like to advise the House that a number of actions have been swiftly implemented to limit potential spread of this new variant. People arriving into the state from overseas who have been vaccinated or recovered from COVID-19 will be required to have a certified negative or not detected test result. This can be from an antigen test taken no more than 48 hours before arrival, or a PCR test taken no more than 72 hours before arrival. And both the PCR test would be anyway, but the antigen test has to be professionally administered and certified. It's not just a question of a person buying a test and doing it themselves and showing a not detected result. This will be in effect from midnight, the 3rd. Air and sea carriers will be required to carry out pre-boarding checks for compliance, supplemented by Border Management Unit, Garda National Immigration Bureau spot checks on arrival at ports and airports. The measure will apply for a minimum period of 2 weeks and will be kept under review with a view to removal as soon as possible, taking account of the overall epidemiological situation and obviously what we find out in the coming weeks about the new variant. These actions agreed by government are intended to limit the spread of the new variant while further evidence emerges relating to its transmissibility, its impact on disease severity, and the potential impact or evasiveness when it comes to vaccines and indeed treatments. My department, the HSC, the Health Protection Surveillance Centre and the National Virus Reference Laboratory have been meeting regularly to review the evolving situation. The epidemiological situation both here and internationally, and all emerging evidence in relation to the Omicron variant will continue to be kept under close review in respect of potential implications for the pandemic. More generally, the government has been quick to act on public health advice as we continue to manage this current wave of infection. Just yesterday, we agreed new advice for families in response to the very significant increases in incidence in younger children in recent weeks. This includes asking parents to try and reduce indoor socialisation for their children aged 12 and younger over the next 2 weeks, and a recommendation that face coverings would be worn by children aged 9 years and over on public transport and retail and other public settings which are currently applicable to to older children and to adults, and in primary school from 3rd class and above. This follows the introduction of a package of additional measures on the 16th of November to reduce the current level of socialisation across the country to interrupt the spread of COVID-19 in the community. Measures include a move to working from home unless it's necessary to attend the workplace in person. Proof of immunity will be required for entry into cinemas and theatres. Bars, restaurants and nightclubs are closing from midnight. Household close contacts who are fully vaccinated and showing no symptoms should now restrict their movements until they have 3 negative antigen test results within 5 days. And as colleagues will be aware, when they are identified as household close contacts, the HSE is sending out the antigen tests to those people in their homes. As the booster campaign progresses, we will continue to take a vaccine plus approach. And what we mean by that is, yes, we will obviously keep vaccines at the centre of our response, but there's more that we need to be emphasising as well. The continued adherence to the basic measures to protect ourselves and protect those around us. This includes acting fast, isolating and getting tested if we have symptoms, wearing a face covering where appropriate, making sure that indoor spaces are well ventilated, maintaining social distancing wherever appropriate, covering coughs and sneezes and keeping our hands clean. We do know that these measures work. In fact, their impact was highlighted in a very significant systematic review and meta-analysis published in the British Medical Journal in October, just last month. That review showed that several personal protective and social measures, such as hand washing, mask wearing, physical distancing, are associated with reductions in the incidence of COVID-19. The research analysed the findings from over 30 studies and found, for example, that there was a 53% reduction in the incidence of COVID-19 with mask wearing. This research highlights the continued importance of these basic protective measures. Despite the current challenges, the steps we've taken together are working to protect our population from the worst of this virus. Our vaccination programme is amongst the most successful in Europe, with more than 90% of the eligible population now fully vaccinated. More than 8.1 million doses of COVID-19 vaccine have now been administered since the programme began in December of last year, with more than 800,000 boosters and the 3rd doses for the immunocompromised administered to date. We all know that every death from COVID is one death too many, and we must do everything we can to keep the mortality rate as low as possible. The latest ECDC data has Ireland with the 5th lowest overall COVID mortality rate out of the 27 EU countries plus the United Kingdom. The booster vaccines are adding further protection. The impact of the recent booster vaccination on those aged 80 and older is evident as the incidence is no longer rising in this group. The health system is being supported at this exceptionally challenging time through significantly increased funding, with over €1 billion extra being provided in budget 2020, bringing total investment to a record €22 billion. Before the pandemic, we had just 255 critical care beds, which I think we all agree was inadequate. We're addressing this lack of capacity as quickly as the HSE can add critical care beds. €52 million is provided for this year to add additional beds, an additional 25% to the base. The HSE has advised that 42 of these are now open, bringing baseline critical care capacity to 297, and more is going to be added in the coming weeks and months, with the HSE funded to reach 340 beds by the end of next year or early 2023, which would represent a 33% increase over the base since the pandemic began. And I've also secured a government commitment to go significantly further than that to in fact bring us beyond the total that was recommended by the 2018 capacity review. We've also added over 11,000 staff to the health workforce since the start of the pandemic. It includes over 3,000 nurses and midwives, about 2,000 health and social care professionals, and we've permanently funded over 1,100 acute beds, acute hospital beds, and about 800 of those have opened so far. I want to assure colleagues that I and this government will continue to do all that we can to respond to this stage of the pandemic, and we will continue to boost capacity in our health service at the same time. And I very much look forward to listening to the contribution from colleagues at this evening's debate. Gurmaga.